Um, Curing the incurable with vitamin C. So, you know, conventional medicine has limitations, right? It can do some amazing things, but there are some things that it can't do. And the problem is it's very closed-minded. If it can't handle something, it just totally says can't be done, and it quits. And that, I don't think, is the right answer. I don't think that's the way to be. So, you know, just kind of a little analogy of what happens. You know, let's say your plant's looking like this. Okay. Now, right now, mine are all perky, but anyway, a plant can look like this. So when that happens, what do we think? Do we think we underwatered it? Do we think we drowned it, overwatered it? Did we not give it any sunshine, put it in a dark room without a window? Did we not fertilize it in the last year, right? It didn't get enough nutrients. Did we water it with reverse osmosis water? Okay, you know, I killed a little bamboo plant like that once, and then I learned, oh my gosh, reverse osmosis water is missing a few things. So toxins, did somebody pour something toxic into this plant? That's kind of what we think about. We never think, does this plant need a drug? But when we wilt, when this happens to us, they bypass that. Is she dehydrated? Is she vitamin D deficient because she's never outdoors? Is she nutritionally deficient? Is she toxic, right? Got, you know, 20 teeth with amalgams in there, works in a factory. Is she exposed to? No, we immediately think, what drug can we give her? That's the standard system, okay? So then for those of you that I'm new to, right? Who am I and why am I standing there with an apple in one hand and a syringe in the other? So I'll give you a little bit of background. So I am, first of all, an import. My father brought us to this country when we were little. Living the American dream, we started with very little and worked hard and achieved success. I was able to actually train in head and neck surgery at the Johns Hopkins Hospital, my brother to the Mayo Clinic. We were very blessed and we worked hard and we got there. During my residency, and even before in my medical school, there was something off. I was the dummy for everyone to learn to locate the thyroid gland in the neck. So, geez, why is my thyroid so big? So it kind of sent me to doctors and I was told, oh, you know, they do a blood test. Oh, your thyroid is borderline. Nothing needs to be done. Come back in 6 to 12 months, right? Kept doing that. I was doing okay, kept going on. I was like, all right, the doctors must know what they're talking about. I'm a lowly medical student. So then got into residency. I actually got married between medical school and residency. When I started residency, pretty soon, it was obvious I couldn't keep up. I would come home from the hospital so exhausted that all I could do was sleep. Every step I took required a sheer act of willpower. Nah, something's wrong, okay? I mean, geez, I did really good in school and I'm smart, and why can't I do this? So went back to the doctor. All right, now there's got to be a problem with me. Go get checked out. Maybe it's this big lumpy thyroid. Again, your thyroid is borderline. No treatment is necessary. You're struggling with residency because it's a lot harder than medical school, especially for women. Maybe you should consider another career like public health. And I'm thinking, geez, public health? That's for people that didn't make it to medical school. I was valedictorian in my class. Somebody suggested I get a second opinion, and I did. And that doctor ran antibody testing on me, you know, like they do for Hashimoto's thyroiditis. And my antibodies were like in the thousands. They're supposed to be like less than 35. Okay. So he said, well, you're having so many symptoms. Let's just try you on some thyroid medication. And it helped for a little bit. And then it didn't. And I was lucky. One of my medical school professors had learned a new way to address the thyroid and hormone replacement for it, and saved me, saved my marriage, saved my career. And then as I am going through a challenging residency, but now I can keep up, my mother developed a whole series of chronic autoimmune problems. And the conventional healthcare system couldn't help her. And I had to learn one thing after the other to try and help her, try to minimize her discomfort and her pain. And that's kind of what put me on track to finally pursue integrative functional medicine. And that's kind of where I am. Ultimately, then I quit practicing ENT and I broadened my approach. And so I have now adopted and find the only successful way to really help people is to have a holistic approach where you help the patients, where I help the patients go through every aspect of their life and improve it. And this involves detailed laboratory testing and helping them to optimize everything from their nutrition to their stress management on the other side. So this is the approach that I use in my practice, and I find that is really the only way long-term to help people get better. Okay, so we're coming towards what we are here tonight to talk about, and that, of course, is vitamin C. So cute little picture, right? A little image of showing you vitamin C up against you-know-who, right? There are right now 23, this is as of about 3-4 days ago, 23 studies in clinical trials using vitamin C for COVID-19, okay? So 23 official studies. The first one was started in China, okay? So we don't have a whole lot of data from these, except for some preliminary unpublished kind of stuff. So there are a total of 39 studies that I found on intravenous vitamin C. Okay, so some of these is for COVID, some of these are not. Okay, so there is definitely some interest, but guys, it's so shabby compared to how powerful this thing is, just because it's not patentable. That's the bottom line. You know, China is where this all started, and so the Chinese had the first crack at it. And interestingly enough, one of the doctors in China, in Shanghai, who became involved with management of this, novel coronavirus, had some experience using vitamin C, and he was using it to treat infections and all kinds of other issues. And so his thought was, well, geez, let's try vitamin C here. And that's where it kind of got used early on. And the Chinese had a very positive things to say about this. In fact, they recommended high-dose vitamin C treatment, and there's a whole, this was in Chinese, available online document, and then we're able to flip a button, these days technology, right, translates it into English. And I have this document, and it's amazing how strongly they feel that vitamin C is useful. But for some reason, we haven't adopted that. You guys know what that reason is, right? A lot of it has to do with dollar signs, because we like chasing drugs here. We will promote anything. People will promote anything where they can patent it and they can deliver. Vitamin C isn't patentable because it's a natural substance. And so it really gets no attention. But I'm going to show you just how powerful it is, okay? So let's talk about some of the basics. Humans don't make vitamin C, okay? Most animals do. Primates and guinea pigs, and maybe that's why they're guinea pigs, because they're more like us, do not make vitamin C. They have to get it from their diet, okay? So when animals are stressed, and this has been studied in great detail, they produce a ton more vitamin C than they do at their baseline, okay? When we're taking it from our dietary sources and we get sick or we're stressed, geez, how many of us are stressed, right? Never, all the time. So when we are stressed, we can't up-regulate how much C we're getting, okay? We're usually not even eating as much as we were before. So we have to fight off things without the benefit of vitamin C. So vitamin C is very definitely beneficial at almost any dose, and I'll show you that. I'll show you a study that really strongly supports that, but it's stronger the more you use, okay? The higher the dose, the more awesome it is, and we'll get into that. Oral doses can generate useful levels. Now, it used to be felt that they really couldn't, and somebody did a really cool study, which I'm going to show you guys recently, saying that oral ain't bad, okay? Of course, IV can really be extremely potent, but the oral you can do a lot with, and that's good because you don't need a doctor involved to do oral vitamin C, okay? A few caveats: if you have any kidney failure, any liver failure, do not take anything natural or unnatural without a doctor's supervision. But if you've got good, healthy liver and kidneys, then you can usually do some vitamins, all right? Oral doses can generate useful levels, we said. Absorption of vitamin C increases during illness. So a lot of doctors have experience with this. When, let's say that I am well and I take vitamin C. If I take more than my gut can absorb, I will have loose bowels. I'll have some cramping. Okay, I've done that to myself, so I know what that feels like. Okay, it kind of forces you to have bowel movements, and if you keep taking too much, it's going to increase that. So you know that you've hit what we call bowel tolerance. Now, let's say I catch a cold or I catch COVID-19. All of a sudden, instead of having this occur at maybe 6 grams of vitamin C, 6,000 milligrams, I can now take 20 grams or 20,000 milligrams of vitamin C and then start to have the symptoms. So as my need increases, my gut can tolerate more. So that you can kind of tolerate how much you need based on what's going on with you right now. Okay, the low doses of vitamin C, like is in a multivitamin, or you take a little 500 milligram, that has an antioxidant effect, right? Antioxidants are good for us, right? Remember, we know that. They're good for circulation, heart disease, inflammation, the whole thing. Antioxidants are good. Higher doses, now vitamin C is no longer just an antioxidant. It can have an oxidative effect. And this is what really helps us to kind of knock out the viruses. So a higher dose. Intravenous doses, of course, really are potent. Okay, so a little summary slide here of the vitamin C, a role of vitamin C in immune defense. So as you can see, this is all, published medical literature. There's a lot that vitamin C does, right? And we know that it's also good for our skin and building collagen and all that kind of stuff, right? Wound healing is really important. And after surgery, before surgery, you should be binging on it, right? It helps your white blood cells knock out microbes, right? Or germs, whatever you want to call them. And it supports antibody levels, right? It actually decreases histamine levels, so it has an anti-allergy effect as well, okay? And I can tell you that because I do have some allergies, and periodically, if I've been neglecting myself and not taking my allergy treatment like I'm supposed to, then I will notice the symptoms flare up, and taking vitamin C will calm them down, okay? So vitamin C has been proven in vitro, in a test tube or a petri dish, whatever you want to call it, to inactivate all viruses. Now that's different. That doesn't prove that it's going to do it in vivo. That means in real life, in a real person, in a real animal. But we know that it works. The big claim to fame with hydroxychloroquine was also that it knocked all viruses in vitro, okay? There's some controversy about that, but that's not the focus of our topic today. So vitamin C, very good activity. It nails the viruses in a test tube or in a petri dish. And it can help resolve all acute viral infections. The caveat here is you got to use enough. Okay, and that's where conventional docs who are not used to using it, if you use the wrong dose, let's say you use aspirin and use 1 milligram, it's not going to do anything. Okay, so same thing with vitamin C. You got to know how to dose it. We're not talking about it as a nutrient here. We're not talking about how much do you need to prevent scurvy. Okay, we're talking about using vitamin C in a pharmacologic or drug-like manner. Okay. Now, know that we can support the body's reactions various ways, okay? We can use a natural substance like vitamins, okay, to push the enzymatic reactions in the body in a certain direction, okay? We can also use drugs to conduct various reactions, but what they're gonna do, they're not gonna stimulate or increase those reactions, they're going to block something. All drugs are inhibitors. They block something. That's by definition how they work. The other thing to know is that all drugs are not substances that are naturally present in a person. They are foreign to us, okay? What we call xenobiotic, okay? Vitamins are things that are naturally present in our systems and essential for our life. And it makes inherent sense to me anyway, that if you have a natural substance that is there normally and you use that, you're going to have less chance of having side effects. And that is very true indeed. Now, you can certainly do too much vitamin C and get diarrhea. You can drink too much water and cause your electrolytes to be off. So everything requires a degree of common sense, okay? Let's move on. So for those joining late, and I believe I do have some here, I can tell how many people are on, so that's how I can kind of tell that. We're going to review vitamin C, its role in infection, and about its role in how it kills viruses. We've been already starting to talk about that. We're going to talk about C as an antioxidant, as a detoxifier, and its usefulness in cancer care, and actually for coronary disease risk. And so that's kind of the sequence that we're working on. We've talked about how there are a lot of clinical trials using vitamin C for COVID-19, okay? And there have been hospitals in New York using it, but in the mainstream media, if you start talking about vitamins, it becomes fake news. So how much you're hearing in the news with vitamins is very restricted, and that's because there is a bias in our media away from natural treatments. So doctors that go about talking about these things basically get not heard. All right, so this is one of the champions of vitamin C, okay, Dr. Klenner, okay? He was an MD, a physician. I think he practiced near Duke, and he was a lung specialist. Dr. Klenner used a lot of vitamin C at a lot of different dosages to treat a lot of amazing patients that recovered when everybody else thought that they were going to die, and these people were at death's door. He was able to treat everything from polio, okay, to all kinds of viral pneumonias and encephalitis, okay? His point was that you have to use enough, okay? If you use enough vitamin C, okay, and he says massive doses of ascorbic acid, yes. The cool thing is massive doses, if you know what you're doing, are extremely safe. You do have to know what you're doing. Get a patient with kidney problems, you can't do massive doses, all right? So that is important to obviously have some caveats. If there is a patient that has a genetic syndrome called G6PD deficiency, that person's not going to be able to tolerate higher doses of IV vitamin C, okay? So there are some caveats, but it is amazing. When proper amounts are used, it will destroy all virus organisms. That's Dr. Klenner in 1974, okay? He already knew this, all right? Here's Dr. Humphreys, right? People in New Zealand have been treating whooping cough with vitamin C for 30 years. I started treating it and I just got grateful patients, okay? So we don't, conventional doctors are not treated, taught what we call orthomolecular medicine, and that's using natural substances in high doses therapeutically. This is not, just know that vitamins to correct a deficiency and to eat a healthy diet is one thing, but to take a vitamin in way higher doses and to use it to treat something is what we call orthomolecular medicine, okay? And that is extremely powerful. This slide here, the yellow square represents a cell. And what it's telling you is that there are two ways, okay, where the ascorbic acid or vitamin C can enter a cell. One in the pink there, you see it says CLUT1 transporter. And that's the same transporter that brings glucose into the cell. And I've heard many chiropractors say, oh, you know, if you eat too much sugar, then you can't absorb vitamin C. Well, not quite so, because on the left there where it says HSVCT1. So that's high sensitivity vitamin C transporter 1. That thing actively will bring in vitamin C, okay? And so that perhaps is what's getting adjusted when we're sick, and that gets upregulated so we can absorb it. So there are systems in place, and vitamin C is extremely powerful, as we'll show you. This is that recent study that I mentioned. Somebody just kind of got this into publication when COVID came out because they thought it was relevant. Vitamin C was an important thing. In the dark line, that's if you're giving vitamin C, 10 grams of it orally, intravenously over 40 minutes. And then if you have somebody sit there and drink vitamin C at about the same rate, 10 grams over 40 minutes, you get that funky little curve at the bottom. That ain't too shabby. We used to think that vitamin C by mouth really was not well absorbed. This is showing differently. So this is where I think it's definitely useful to use it as a strong weapon against viral illnesses at home. So this is when 10 grams was taken as a gulp all at once, okay? It's showing you that it got really high levels. It got picked up. So even as the gulp, it's getting in there. The intravenous level is there, looking good and steady in that solid line, but the gulping really gets it in there. So if you drink it quickly, you are going to increase that level quickly, okay? Now, because orthomolecular medicine and vitamins get purported to be fake news, I want to, as I go along here, I'm going to show you guys these studies that are published in the medical literature, okay, peer-reviewed kind of things, and I'm telling you how they're ignored. Conventional doctors are not aware of this literature. It's in there. It's in PubMed. Okay, that's where I got these. There are over 64,000 citations on vitamin C in PubMed. Okay, this is a summary one from 2017. Okay, they looked at a bunch of different trials and they kind of summarized them. All right, they said 2 controlled trials found statistically significant dose response for the duration of the common cold symptoms. So that means if you took more, it worked better. Up to 6 to 8 grams of vitamin C. Now, most people's idea of taking vitamin C is 500 milligrams a couple times a day, or a gram a couple times a day, 1,000 milligrams. Guys, that's not enough. If you're sick, you need more, okay? So that bowel tolerance, and we'll talk a little bit about that as well, so you understand how to do that. The negative findings of some therapeutic common cold studies might be explained by the low doses. So if they're only using a couple of grams a day, it's not going to work as well. And they say, oh, vitamin C doesn't work. Doesn't work if you don't use the right amount, right? 3 controlled trials found that vitamin C prevented pneumonia, and 2 controlled trials, which is all what conventional doctors value, found a treatment benefit of vitamin C for patients with pneumonia. Okay, so not only is it preventing pneumonia, it is actually helping to treat it. Okay, this is by Dr. Cathcart. Dr. Cathcart was another champion of vitamin C, and he describes in great detail in this the amount of ascorbic acid tolerated. And I said this earlier, without producing diarrhea increases somewhat proportionately to the stress or toxicity of the disease. The sicker you are, the more you can absorb. Okay, so bowel tolerance ameliorates the acute symptoms of many diseases. Lesser doses often have little effect, okay, on the acute symptoms, right? They're still useful, but they're not going to work as well, okay? So when you are very sick, and this happens severely with COVID, right? There is so much inflammation, the cytokine storm, you might have seen that term. There are a lot of free radicals that are formed at a rate way faster than the body can clear, okay? And if you use little teeny doses of vitamin C, 1 to even up to 10 grams per 24 hours, it's not gonna do much. But when you use it in massive doses, what's a massive dose? 30 to 200 grams, okay? And I fairly often will go 25, 50, 75 grams in a couple of hours. okay? But I'm not in a hospital setting. I'm not treating acute septic patients, but acute septic patients with like encephalomyelitis, hell, if it was me, I'd want that 200 of IV vitamin C, okay? So they actually, it says provide electrons. So this is where that oxidative stress comes in, and this is where they really help those free radicals basically be quenched, okay? This is a really cool study that looked at, this was a double-blind placebo-controlled trial, right? That's the only thing doctors believe in. But there's some things you can't do a double-blind placebo-controlled trial of. We'll get into that some other day. But 57 elderly patients, some of them given only a mere 200 milligrams, and that's like peanuts, right? They did better than placebo. And this is elderly patients hospitalized with acute respiratory infection, e.g. pneumonia, influenza, right? So these patients at just 200 milligrams a day, they survived better, they fared better, they got out of the hospital faster, okay? So even a little is good, more is better. Extra dose of vitamin C, right, on a daily supplementation shortens common cold. It does. Nothing works for the common cold. Wrong. You take enough vitamin C, it's going to work for the common cold. I put this slide in. This is from the Institute of Functional Medicine, and it tells you that nutritional deficiencies are rampant. Okay, just look at that. Look at selenium, right? What percent of the population deficient? 14. If you look at vitamin E, 86% are deficient, okay? If you look at zinc, 42. Zinc is really important with immunity and with COVID. So you know, more than half of the people are deficient in zinc. Magnesium is also important, right? And you've got 68% of the population not meeting magnesium requirements. That causes a lot of symptoms, guys. This is just about vitamin C, but magnesium is critical, all right? It's involved in hundreds of chemical reactions in the body, okay? So when we are deficient, right, vitamin C is saying about 48% of the population does not have enough. This is just to prevent scurvy. This is not if you're sick, okay? So point being, you are sick, you need more. So let's talk about kind of what do you do, and I kind of give you guys doses. So vitamin C, for children, 500 milligrams twice a day, okay? Toddlers, I'd probably do less, right? But, you know, kind of children somewhere in the range of 6 to 10, 500 milligrams twice a day is kind of a good, right? Prophylactic dose, right? So in cold and flu season, you want to do that every day to prevent. For an adult, at least 1,000 twice a day, okay? Vitamin D is also critical, goes hand in hand for immunity. So in infants, about 1,000 I use, 2,000 in children, 5,000 in teens and adults. Some adults require more, okay? It's really by level. If you can, encourage your doctor to find out what your vitamin D level is for you, simple blood test, okay? It's not routinely done, so you have to kind of ask for it if your doctor's not doing it. And that's how you want to best do your level, regulate your level. Vitamin C doesn't matter. It varies so quickly you from moment to moment. So you can't really rely on vitamin C level. A multivitamin, because you saw all those deficiencies, you want to try and meet as many of those as you can, okay? Now, let's say that you got sick, okay? So I always will give you the caveat, call your doctor, discuss your symptoms, especially in the day of COVID. We know that some of us are at higher risk than others. You want to make sure that you are not going to harm yourself. So always be working with someone. You can increase your vitamin C. Again, remember, kidney failure, liver failure, don't mess with it, guys, without getting direct advice from your personal physician, okay? Increase the vitamin C to maximum tolerated without diarrhea. You can do that with vitamin C powder that you kind of sip on, you know how much you have, how much, and kind of sip that through. People like me who have trouble swallowing pills, it works really well, okay? Otherwise, you can take 1,000 milligram capsules every hour or take 2,000 milligrams every hour and see at what point, oh geez, I took 6 of them. So that's, 6,000 milligrams and I don't notice anything. So for the next few hours, keep going, okay? You get some cramping, some loose stool, okay, I hit my dose. So about 80% of that total dose divided 4 times a day is a good dose for you then. As you start getting better, your need will decrease and you won't be able to tolerate that much and you'll just back down. All right, that's taking vitamin C to bowel tolerance, okay? Vitamin A, if you're sick, also is very useful for the immune response, okay? When you're acutely sick, again, if you're my patient, I'll sometimes tell you to take a lot more, but as a general guideline, I don't want to say that. Pregnant women can get into trouble with vitamin A. 10,000 and less a day is going to be safe for everybody. So that's why I'm going to say that. NAC and acetylcysteine, another nutrient I find very useful, cuts inflammation, supports glutathione, helps those lungs, okay? This is not a prophylactic dose if you're sick. Prophylactic dose, you can take 500 milligrams twice a day on an empty stomach, okay? Good stuff. 1,000 3 times a day on an empty stomach is where I would have somebody that's got a viral infection going. All right, now let's get into the real fun stuff, the intravenous vitamin C. So I hope I've given you enough information. And guys, I'll hang around so you can keep typing questions later. Let me see, yeah. And as things come up, go ahead and type them and I'll scroll through later to go through and answer those for you, okay? IV vitamin C, let's talk about that. So this is 2019. This is a study, one of those double-blind, placebo-controlled, multi-center intensive care unit study. So this one really stands out with intravenous vitamin C. So they had septic patients that were like at death's door, that kind of horrible infection. Sepsis is horrible. It still kills people, okay, everywhere, even here in the US. And what they found was that using a little bit of vitamin C, relatively speaking, to me, 50 milligram per kilogram of intravenous vitamin C is a little vitamin C for a really sick person, okay? But anyway, conventional docs are not used to using high doses, and so for them, that was a generous dose. They noticed a 16% decrease in mortality. 16% fewer people died, and they were in the intensive care unit overall 3 days less. Every day less that you're in intensive care means you got a better chance at making it and not dying, okay? So this study showed very significant effect at a relatively small dose. They were given 3,500 milligrams over 6 hours intravenously, and then next 6 hours they repeated it, okay? So 14,000 milligrams over 24 hours. And as I told you, I'll do 25, 50, 75 grams over a couple of hours in the office. That can be quite safe, okay? So here's a study looking at intravenous vitamin C. This is on patients in septic shock whose blood pressure is dropping and they're requiring drugs to pump up their blood pressure so that they don't get brain damage, okay? 28 patients randomized, okay? There you go. Again, it was one of those placebo-controlled, right? 14 got it, 14 didn't. The 28-day chance of dying was 14% if you didn't get vitamin C, and 14% with vitamin C, saying that backwards, and 64% without vitamin C. So that's a huge improvement in survival, my God. So after this, you would think that every doctor everywhere would be giving vitamin C to people in septic shock to save them, but it doesn't happen. These studies, they just kind of disappear. Nobody pays any attention, okay? And this dose was even less than the previous study, 25 milligrams per kilogram every 6 hours, okay? So again, the data is amazing, but it just totally goes ignored, okay? Phase 1 safety trial. Here they're trying to see, well, what dose is really safe? 8 patients got nothing. 8 patients got 25 milligrams per kilogram, and 8 patients got a whopping 200 milligrams per kilogram. Okay. And what they noticed was, this is again in septic patients, you have to not only prove that ascorbic acid is safe in good, healthy people, but you have to prove that in a septic patient, it's not going to do anything to make them worse. Okay. So that's what this safety trial is trying to prove. And they took the dose up to 200 milligrams per kilograms, what the Chinese also used for COVID. And they noticed prompt improvement in organ failure. So, whoa, chance of life. Okay. Huge. Again, nobody knows. The intensive care doctors in the hospitals do not know about these studies. Here's another one. This is a few years ago, and this study, this physician combined vitamin C with hydrocortisone, which they use in septic shock sometimes, but they don't get great results with it, and a little thiamine, okay? And the mortality went from 40% dead to 8%. Huge. Okay, again, every center in the US should be adopting, this little trial, okay? But it's not. They call it the HCT trial, but it's not done. Nobody knows about it, okay? This is a case study. One person, this was with acute respiratory distress syndrome. This was a young girl. She was dying. Literally, they had put her on ECMO, which is where they basically bypass your heart and lungs and give you oxygenation peripherally because your lungs are just not working. And they gave her intravenous vitamin C at that generous dose, and she made a rapid recovery. Okay, so the data is there. Now we're getting back to COVID here. 12 grams of vitamin C. This was the initial vitamin C study that was set up. Okay. And again, 12 grams, not a huge amount. Okay. And then they planned another intravenous vitamin C study, and this time 6,000 milligrams and 12,000 milligrams per day for moderate and severe cases. So again, they're trying out different dosages to see what works. Again, conventional docs are not used to this. If you go back in time, Dr. Klenner, 1948, was making miracle cures, but using big, generous doses. Now docs are naturally afraid of natural substances. They're not afraid of drugs because they're comfortable with drugs. That's all they know. What they know, they're comfortable with. What they don't know, they're afraid of, which is understandable. Okay. The sad thing is this data exists and the doctors don't know about it. Okay. So they wanted to include vitamin C. This is one of the Chinese Dr. Mao. He was the one who had experience with vitamin C. And so he talks about the dose range, right? Where they use 10,000 milligrams or 10 grams for the moderately sick and 20,000 for the severe cases. This is an intravenous, and this is how they got good results, right? Those patients that got the vitamin C were in the hospital shorter. They got better, they went home. And then Dr. Mao had a really sick patient that was going down the tubes fast. Instead of putting him on a ventilator, he bolused him with 50,000 milligrams of vitamin C, which, as I said, I've done over a period of 4 hours in the office. It is that safe, okay? The patient stabilized and literally improved as the team was watching in real time, which it just floors you, right? But again, conventional medicine does not take notice of this. This just kind of goes away, all right? I want to make a few points about detoxification, all right? Vitamin C, because it is a free radical scavenger, will help to detoxify, okay? So if you are exposed to chemicals through your work, let's say you clean houses for a living and you've got cleaning chemicals and so forth, vitamin C is a very useful detoxifier, okay? So in terms of finding data on it, I did not find human trials, but here they looked at cadmium in particular, heavy metal, and they found that these are quail. They improved and their egg quality improved. They were spared the toxic effects of cadmium, if they were supplemented with vitamin C. Okay. Now, other things are also used as detoxifier, and certain types of clay are in that. So they compared both, and they both were helpful. Okay. So vitamin C is very easy to take, and with as many benefits as it has, preventing infection, this is another side benefit that you get. All right. So heavy metals and antioxidants. So antioxidants definitely protect against heavy metals. And so vitamin C is a cheap, simple antioxidant to get. Okay. The cheapest form of vitamin C is probably ascorbic acid. Okay. It's generally derived from corn. If you have a corn allergy, you're going to want to get it derived from tapioca or from another source. Okay. The ascorbic acid in capsules and such, most patients can tolerate it just fine. There are some that can't. There are other forms, guys. Ascorbyl palmitate is a fat-soluble form. Anybody that has any kind of stomach upset issues can switch to that. A lot of people can tolerate simply buffered ascorbic acid. Okay, you can purchase buffered ascorbic acid. It's going to be buffered either. The simplest is where it's buffered with sodium. Okay, so it's not sodium chloride salt, so it won't raise your blood pressure. Okay, it's sodium ascorbate, and that the benefit of that is that if it's not going to upset the stomach as much as is your ascorbic acid. And also, if you drink ascorbic acid powder in water, it's not good for your teeth, right? It's acidic. So you would want to buffer it. And a simple home remedy for that is to throw some baking soda. So that's sodium bicarbonate with your ascorbic acid, and you end up buffering it, and it bubbles and fizzes and so forth. I find about a quarter teaspoon of the baking soda to 1 teaspoon of the ascorbic acid powder works real well. Okay. The buffered, they will sometimes put magnesium and calcium and those minerals. And if you're trying to add those to your diet, that's one way to do it as well. I'm not a big fan of calcium supplements, though. Love magnesium. So these are all simple things that you can incorporate. All right. In terms of therapeutic perspectives, we talked about detoxification. We talked about antiviral activity. Another big one is anti-tumor activity. Okay, ascorbic acid seems to, in high enough doses, again, low dose is not going to do anything. So if you're taking 500 milligrams twice a day and expecting that to make some tumor go away, it's not going to happen. But really, really high doses of ascorbic acid will poison cancer cells, but will not harm normal cells, presuming you don't have a G6PD deficiency. So it's very beneficial from that standpoint, okay? And intravenous vitamin C is used. So vitamin C versus cancer. Now, one thing to note is all oncologists, cancer specialists, are very afraid of antioxidants. They feel that the chemotherapy might be rendered not as effective when you have antioxidants on board. Some of them will go so far as to tell people not to eat kale and broccoli because it has all these good nutrients and antioxidants. The literature doesn't support that. Most of the studies do not show a negative effect. Okay, you can always find 1 or 2 studies that will show you some effect, and those certainly exist. And unfortunately, when you have a mindset that it's a problem, then you tend only to see that study, and that's the study that you really focus on. But if you look at the whole data does not suggest that vitamin C or other vitamins are really going to turn off the effect of chemo. You want to be careful. There are certain nutrients that are going to impact certain chemotherapeutic agents. So this is where you really want to work with somebody that knows what's going on, what chemo you're on, and so forth. Sadly, though, your oncologist is not generally going to be able to give you that entire information, okay? So vitamin C definitely in high doses can help therapeutically. In fact, if you do it before doing radiation, chemo, and putting the patient through that, you do a few cycles of intravenous vitamin C, and then you can even pause when you're, and do it again when there are pauses in chemo or after chemo. If the oncologist is uncomfortable with that, that will help. It will help in be an anti-tumor, and it will also help by helping the patient to be able to tolerate the chemo better, okay? So that's where this study kind of comes in, intravenous vitamin C. This is a review in supportive care of cancer patients. So there are many studies looking at different cancers and how vitamin C can help. So supportive patients fare better. They don't lose weight as much and they don't suffer as many side effects. I would not tell you that vitamin C is a cure for cancer. It definitely has benefits, but you do not want to say, oh, I'm going to just take vitamin C to bowel tolerance and that's going to be it. You have to do a lot more. Certainly people have resolved their cancers by doing only natural things, but that's where you really want to hit it with all aspects, not just one. Vitamin C is extremely powerful. Again, I see its biggest strength in infection, okay? But certainly in the realm of cancer, it is indeed as well useful, okay? Inflammation, right? We know that inflammation is the root cause of a lot of disease. Everything from heart disease, right, to autoimmunity is founded on inflammation. And so vitamin C will help the vascular lining to be not so inflamed. So it can help to basically limit how much atherosclerosis forms. So antioxidants are useful. Vitamin E, vitamin C have a role here, okay? So vitamin C I use very generously. I will easily recommend 1,000 milligrams 2 to 3 times a day to adults. It's cheap. It is highly useful. It keeps you from getting sick, okay? So there is essentially nothing to lose. So guys, if you're interested in more information, please do visit my website. We do some other types of therapies and you can learn about those as well.